Good afternoon to those of you who are in the afternoon, and good morning to those of you who are not, who are joining us from time zones that are still in the morning. Happy Wednesday. We are delighted that you're here. We are excited to share some additional clarifying information with you. My name is Kim Sterrett. I'm Director of Parent Family Programs here at the University of Alabama, and we're delighted to have you all join us today. And I'm so thankful to be joined with so many great colleagues from around campus. And my first colleague who I'll be introducing to you is of course my favorite. It's also because he's my supervisor. And so he of course is my favorite. But Dr. Myron Pope is here, our Vice President for Student Life. And he's going to give us a little bit of an update about kind of where we've been, what we anticipate for the spring, and just give you a brief summary. And I'm going to be his assistant and share his slides with you. Thank you, Dr. Pope, for being here.
No problem. Kim, thank you so very much. And please know that you are my favorite. Don't tell everyone else in the division, but thank you for always making sure that we have a great working relationship with our parents and families. Your role in your office, your team does a phenomenal job of making sure that they are abreast of everything that's happening on campus. And likewise, you guys do a great job in terms of just providing support to them. So thank you for all that you do. And certainly thank you for making sure that this event is possible today. Erica Mason Embody, our Chief of Staff for the Division of Student Life, thank you so very much for working with Kim to make these town halls a success. And thank you also to our panelists, Dr. Friend, Dr. Hahn, I would say Dr. Joyner, but we've got to get him through his undergrad first, but he's a phenomenal leader as our student government president. Thank you for taking time out of your busy schedule to be a part of this to help inform our parents and families about where we are. Well, happy holidays. Thank you for being here today. And I know that many of you have submitted questions, and for some of you, it's an opportunity for you to find out where we are as we get ready to plan for the spring semester. It seems like just yesterday that we were talking to you about where we were on the front end of the semester and in August and September. And, I remember one of my colleagues posting on a weekly basis. We can always put things into context related to football around here in Alabama, but there was a field that someone had, and essentially what had happened was that each week he would do 10 yards as we moved towards the finish line. And I think we have officially crossed the finish line now, crossed the goal line, so to speak, and that's a good thing. We got the students through. We had some peaks and valleys for sure, but certainly on the back end, we felt very good about what we did in terms of making sure that we kept the campus healthy and safe. And I can't say enough about our students. Our students did everything that was asked of them throughout the semester. Due to that, we were able to keep everyone on campus and be able to finish up the semester. So thank you for all of your support and questions along the way. We can't say enough about all the support that we received from you during that time. And please know that we're here for you as we continue to move forward. Kim, let's go ahead and get started with the slides. First slide. Please keep in mind that everything that we're sharing with you today is accurate as of today. There is so much information that's coming at us constantly. We have a campus-wide situational response team that meets on almost a daily basis at this point. That team, including Dr. Friend and so many others across campus, and certainly sometimes off campus, provides us with a lot of information, a lot of data that we are considering. Across the country right now, many of you are experiencing peaks. Well, all of us are experiencing peaks right now in positive cases across the country. And certainly that's at the forefront of our minds and thinking about how we prepare for the spring semester. Obviously, again, we're 2-3 weeks away from that time period. There's a lot that will happen, but please know that everything that we're presenting to you is based upon what we know as of today. As we receive new information, we will certainly keep you informed. The thing that I've learned the most about this, again, put things into the athletics analogy mindset, is that we have a great plan going into the spring semester. But with any plan, as you go into athletic events, and certainly this weekend as we go into the SEC championship game, we may have a game plan, but there are always wrinkles. There are always curveballs that your opponent will throw at you. In this case, with COVID and the data that we see and things that we're monitoring, there are going to be changes, and we have to remain nimble. But we know that we are well informed at this point, and we feel like we are always at a place where we are able to make those adjustments to our operations to ensure that we're in the right place. As students return, the first place I want to stop is with our return testing. Return testing is required for all students who live on campus, and you'll see three options here. Number one, the students have the option of coming back to campus and being tested here on campus. That testing will take place between the 7th and 19th. Dr. Friend, who is our dean and leader for UMC, they will be providing free testing for all students who are interested in coming in and getting that testing. That scheduling process will be online. So if you have a student who wants to be tested during that period of time, that system will go live at the beginning of the year, probably around January 2nd, to allow your student to be able to go in and sign up for a time to be tested. The second option would be for individuals who have tested positive since October 28th. We know that many students have probably tested positive during that period of time, and what we want to do is allow those students to submit their proof of positive COVID tests to the Student Health Center and affirm that they've served the required isolation period. Obviously, again, that time period is a 3-month window that obviously moves from that point of initially being tested positive. But for those students who can provide that verification, they will be able to upload that information to the Student Health Center website, which will go live around January 2nd also. So make sure that that your student is on the lookout for that option. The third option would be a testing with a personal doctor. Students may choose to use their personal doctor prior to arriving back on campus. All of those results must be PCR based. And again, as you go out and start doing research with your doctor, they will know exactly what that means. And that must, with that test, it should not be conducted more than 7 days prior to your student's return to campus. Test results must be uploaded also to the Student Health Center website, and those uploads are available, will be available between January 2nd and January 12th. So those are three options that are available to students as they come back. Again, we are not providing other options at this point in time, but as we had in the fall semester, but we want to make sure that you were aware of these three options, just because we've changed this process a little bit from the fall semester to where we are right now. Next slide. As we did with the fall semester, we will require that students go through and do training. Now, training is a is a module whereby students will log in and just go through that process, and it'll tell them everything that they need to know about returning to campus. There will be information about the return testing. There will be information about expectations once they return to campus. As you know, we really are going to highlight everything that we've said before in terms of social distancing, masking, and certainly making sure that they complete the health check. But this information is so very critical for them to be aware of during the time that they are preparing to return to campus. Likewise, the other thing that we want to highlight, again, all students are required to complete that process, by the way. That should be available no later than January 7th. And the other thing that we want to encourage students to do is make sure that they check their emails. Obviously, we want them to have a break during the time that they're away. But as I said, this is a very dynamic environment for us. Things are constantly changing, and we will continue to keep you updated about everything that is taking place. So by checking their emails, that will give them the latest information and keep them on par, make sure that they receive all the information to return successfully. Final thing that I have on this slide is that as we have encouraged students to do during the semester, we want to make sure that they are continually going through the health check usage process. Essentially, right now, we've said every single day it's important that students check in and do that. As they return for the spring semester, that will be the case also again. Next slide. First 2 weeks of class. Once students return, we learned a lot this past fall. And when we came back in the fall semester, during those first couple of weeks, we had a high number of positive cases. And that really almost caused us to make a decision to end the semester early. And fortunately, again, we put into place some restrictions on programming, et cetera. And what we want to do this time around is pretty much to do the same thing. With all events, both events in general as well as social events, we're going to have some limitations just to get everyone back, get everything settled, make sure that we don't have an initial spread that will cause us to, that could potentially threaten our ability to complete the semester. Again, we were very successful this semester in terms of not having to discontinue face-to-face instruction, but to start us off on the right foot, we're certainly going to do that again, start off that way for the first couple of weeks. We will continue to communicate with you through certainly messaging through Cam's office, as well as you will continue to receive information from us through these town hall types of situations as changes occur to give you a chance to ask us questions. We always think about our community. That's with 30,000 students returning to the Tuscaloosa community from across the country, around the world. Our goal is to make sure that we are good community members. We want to make sure that students travel back into the community, even though they have a negative test as they come back in. We had a very low percentage of students coming in this past fall who had negative tests, but it was right after we arrived on campus with as students went out into the community. That's where we started seeing problems. And what we want to do is make sure that we are, again, good community members here in the city of Tuscaloosa and the Tuscaloosa community region as a whole, and make sure that we also try to keep down the numbers at the hospitals. As we know, our students typically are not the ones in the hospitals. But please know that, if we are seeing situations where our students are contributing to the spread, it has an impact on our community. And, it's not always, again, the fact that we are thinking about students going into the hospital as COVID students, patients who have COVID. It's also making sure that we keep our ICU numbers down as a whole, because God forbid, if something happens to your son or daughter in terms of an emergency situation and the ICU beds are filled, or if the hospital is filled, it creates a major challenge for the city as a whole. So making sure that we prevent the spread by being good partners, good community partners, is something that we want to do. So I think that's it in terms of my slides. Thank you so very much for your role and your partnership in terms of supporting our efforts. And I hope that this is very helpful to you as we think about the start of the semester in terms of retesting, as well as the expectations for your son and daughter as they come back as students for the spring semester.
Terrific, thank you. Before I hand it off to Erica to moderate the rest of the questions, I do just want to summarize and make sure that we're all on the same page as far as what Dr. Pope just shared. And that is that the only students who are required to test for reentry would be students who live in residence halls and students who live in Greek housing. So that if your student is off campus or does not live in one of those two locations, then they are not required to test for reentry. There are 3 options for that reentry testing requirement for those students who are required. The first being if they have a positive test since I believe it was October 23rd, then they can upload that test result to satisfy that requirement. They can test privately within 7 days of their return and upload that negative test result. Or the majority of the students that we anticipate fulfilling this requirement are going to test once they arrive back on campus with a free test that they do within the first 7 days that they are back on campus. We do anticipate that they will stay on campus as they are awaiting their test results. This is a total flip from what you experienced last fall. Last fall, the on-campus testing option was the last result or last resort, I should say. And this time we actually anticipate the majority of students going the on-campus testing route. All students will participate in the health checks, and all students are required to complete the training. So I just wanted to summarize, and I will now hand it off to Erica for her to go ahead and start these questions.
Thanks, Kim. Just for quick clarification, the pass positive date is October 28th. So that if you have tested positive since then,
thank you.
You would be in the window. Yeah, just wanted to make sure I was clear. So thank you. And thank you, Dr. Pope, for getting us a really good foundation for these questions. Thank you also to our three panelists who are joining us. Dr. Friend is a physician and is the Dean of our College of Community Health Sciences. Dr. Hahn is our Associate Provost for Academic Affairs, and DeMarcus Joyner is our SGA President. So thank you all so much for joining us. I'm going to work us through some questions that our parents and family members have submitted, and I'll kind of bounce from panelist to panelist and try to get through as many of the questions as possible. But let's start with the re-entry testing that Kim was just summarizing for us. Dr. Friend, I'm going to throw the first question to you. So we heard the re-entry testing requirements. Can you help our parents and family members understand why we are only requiring this of our on-campus students? In the fall, we required everyone, but why the change? Help us understand that difference, please.
Sure. Well, thanks everybody for being here today, and thanks Dr. Pope and Dr. Hahn and Marcus for all of your hard work and student life. The students really did a great job last semester listening and helping us get through the semester. Last semester, there was a lot we didn't know. And so we decided from a health and safety standpoint that we were going to test every faculty, staff, and student on campus to understand what was coming into our community. And what we learned is that very few people were positive. It was less than 1% for faculty and staff and less than 2% total for students. And so that information provided us a valuable baseline at that time. But we know that testing everybody is not a good use of resources, and it really doesn't provide that much information. So what we want to do is try to have very narrow, focused data that helps us with everything that we've learned since the pandemic started, which is a lot. We've learned a lot. So what we're proposing is to test all approximately 10,000 residential students, because we know in the residential areas, the risk for spread is much higher. In dorms and Greek houses, as people congregate together, we want to ensure that we're not creating infections by bringing one person in those geographic areas back that may be positive. The other thing is we know there's a lot of value in sentinel testing. So we're going to be doing sentinel testing, which is testing a defined percentage of the entire population every week for 3 weeks in the spring semester, and then every other week. And what is going to make it different is that we are doing the sentinel testing ourselves. It's not going to be an outside party. The university and University Medical Center have invested a lot in really good PCR equipment. It's easier to collect. It's more accurate than what we had before. And so I think between the reentry testing for the residential students and the sentinel testing with more numbers is going to provide us with the most data. And I can tell you that we reviewed every single case last semester. We know where basically they were contracted. We knew who got sick. We contact traced every single person through our group. So we have a lot of information, and I get the numbers personally every day on the half day. So I think we have a really good roadmap for what we're doing and why we're doing it, and the most efficient use of resources throughout the semester. We'll also continue to do exposure and symptomatic testing for any students that come back. Once they get back to campus, that'll be available every day of the week. And we'll also do geographic testing. So if we see cases in particular areas, more than 3 cases, we'll go out to that area and we'll test those places. And then we'll take those people out of the campus circulation by putting them in isolation and quarantine. And that's been really effective. And we've created really a bubble on campus that's safe. Our classrooms are really safe. We know we haven't seen any transmission in our classrooms. So we really want to get the students back. We feel like they're going to be safest here on campus while they're in class.
Great. Thank you, Dr. Friend. I have one quick follow-up. A parent submitted a question about in the fall, we were using some different processes for out-of-state students, and we were allowing them, or we sent them mail-in test kits. The mail-in kits are not an option for the spring. So when a student returns, if they're from far away and they return to campus and they test the day they arrive, can you talk a little bit about what will happen in that interim while they're awaiting test results? Are they allowed to go back to their residence hall rooms since that mail-in process is not an option this time?
Yeah, if you choose to test with your private provider, that would be an option. What we would do is, yes, you would test. We'll get the results back within 48 hours. And then we will contact those folks. And then if they are positive, put them into isolation. All of the students have access to their dorms. There's no way to lock them out. So we understand that they're probably going to go back. We're going to continue to educate with all the health and safety precautions, particularly until we get the test results back. But we plan on getting the results back very quickly, and then getting folks into the proper accommodations as soon as possible.
Great, thank you. One more question about testing, which I'll throw to DeMarcus, and then we'll shift a little bit to academics. But DeMarcus, Dr. Friend talked about the Sentinel testing process being different in the spring. Can you talk about, from a student perspective, how we might encourage more students? Only certain student populations are required to participate, but we'd really like it if everyone who is selected participates. So from a student perspective, how do we encourage students to actively participate in that Sentinel testing process, and why should they do that?
Great question. First of all, I want to say thank you to Dr. Pope and Ms. Kim for letting me get on this call today. I've been wondering when my time would come. I guess I thought it would be earlier in the semester, but you finally got me. But to go back to your question, Ms. Erica, I know I've been working with the president's office as well as Dr. Pope's office to talk about incentives for Sentinel testing. So I think that'll be a huge encouragement piece, so to speak, as far as getting students tested. Also, I believe it's on the students to kind of force their counterparts and their fellow friends and fellow classmates to get tested, just to make sure that they are safe for the students who have underlying conditions, or friends who may want to go home, or even their faculty and even the faculty and staff at the university. So I think that's the biggest piece we can use to push our students to get Sentinel tested.
Great, thank you, DeMarcus. I'm going to shift our questions for a little bit to focus on some academic questions, which come a lot to you, Dr. Hahn. But we have a lot of families who submitted questions about the classroom and classroom instruction. So can I ask kind of a broad question for you to start? Can you describe for us, what are the different instructional methodologies? I know there's a face-to-face and there's a hybrid, but that's different than online. Can you talk us through what the options students had when they were selecting their classes for spring?
Sure. First of all, I just want to say thank you for inviting me. Thank you for having this opportunity to meet with all parents again. The instruction for the spring has 4 types. We call the first type is a face-to-face. That's very easy to understand. It's like a normal class. You come to the class, you meet with the faculty, and it's two-way communication, lecture assignment, the same as normal time. And the second type is we call hybrid. The hybrid is you have in-person component, face-to-face component, not necessarily a lecture. It could be lab assignment, could be a lab practice. And also you will have either online component, the lecture or the PowerPoint slide being posted, or you could have a Zoom, real-time Zoom session. So you have an in-person component. You also will have a Zoom or / online component. And we would like to see 30 to 50% of in-person component for all hybrid classes. The third type is really, we call it interactive audio video, which is basically a real-time Zoom. So your students will have to go to the class at a particular time. This is not on their own. You have to go to class and you will have to see the face of professor talking and listen, raise your hand. You know, it's the same thing as a face-to-face, other than this is virtual. Then the last type is we call it internet. This is the type is basically, I think the faculty member create modules and put all the necessary assignments and lecture notes online. And so all the conversations being via emails or chat board. And also there will be no class time assigned for these. So some students prefer this way because you have the freedom. You know, you can look at your lectures, so you can look at everything, you know, on your own time. One thing I would like to say, the difference between the spring and this fall, even though we're carrying the same type of 4 instruction modes, but the spring, we increase the face-to-face classes from 34% to 46%. So roughly we have half of our classes in the spring will be face-to-face, not hybrid, face-to-face. Secondly, we listened to the parents' call, and I got quite a few emails. You told me you don't like a recorded lecture. So we decreased the internet courses. The internet is the last mode from 14% to 8%. So it will be very, very small number of our courses in the spring will be so-called recorded lectures. I just want to assure you. The number 3, which is the hybrid class. I think there are a lot of questions about a hybrid, and we got feedback from parents, from students that hybrid, even from faculty, is hard to manage, you know. Office Academic Affairs have tried very hard to define what hybrid means. We also decrease the hybrid courses we offer from the fall to the spring from 36% to 32%. So half of our classes face-to-face. We'll make it simple. Come to the class, like Dean Friend just said, our classroom is safe. Come to the classroom, please attend, tell your students, parents, please tell your students, and encourage them to go to class, because that will encourage our faculty, energize the faculty when they see all students showed up rather than, you know, only 5 students show up. Let all students show up. I think our faculty will be very encouraged, and hopefully students will gain the most from our face-to-face classes in the spring.
Thank you, Dr. Hahn. That was very helpful. I really appreciate the percentage information so our families can understand what our mode of delivery is. Thank you for that. A follow-up question for you, Dr. Hahn, that DeMarcus, you may also be able to add some information to, but one parent submitted this question and asked if there are areas on campus that are available for students to use when they have those interactive Zoom classes. This parent was talking about their student lives in a traditional style residence hall. And when both of those residents have Zoom interactive classes at the same time, it created some struggles, right? To both be able to focus and listen and interact. And so if a student is in that situation in the spring where they and their roommate maybe both have a Zoom interaction at the same time, do we have space available or options where those students may be able to take class outside of their residence halls? I'll start with you, Dr. Hahn, and then DeMarcus, if you have any other information.
Sure. This fall, when we started this fall, actually in the first month, we didn't realize this. We learned everything, like Dr. Pope just mentioned. We learned a lot this semester. When we started this fall, we didn't know or didn't realize how important we need to designate, we call a virtual learning space, until I think DeMarcus and the other student leaders and come forward and tell us, where we can find, the quiet place while maintaining social distancing, also have the privacy, and I can put in my earphone or I can watch my Zoom. So we inventory all our classes, and we figured all our classrooms, if they're not used for face-to-face teaching or hybrid in-component teaching, in-person component teaching, why we use that space, make it available for students to walk in anytime, any building, and they find a place they can sit there, participating in their Zoom class. So this semester, I think that's in the mid part of the semester, we create a virtual learning space. We identify 60 rooms that are available for virtual learning, and we post their teaching schedule outside these doors. But we were not satisfied with that for what we accomplished this fall. For the spring, we will make these spaces be more searchable. Students can log in, just basically key in, I need to access such room in this time, at this area, which room is available. We're hoping that website will be launched before the spring semester class started, so students will have an easily identified virtual learning space. And I anticipate, it's gonna be at least 60 spaces or classrooms. So now I turn to DeMarcus.
Dr. Hunt, I think you hit everything, but I guess for parents, this goes to show the Student Government Association started this idea, and we went to academic affairs to the provost office, and they literally took this idea and ran with it. So it goes to show that the university not only listens to Student Government Association, but also any student on campus. So make sure your students, if they have a problem with anything, come to us. And we're located in the Ferguson Center, and we'll take their issues straight to administration, or they can go with us to administration to make sure that their voices are heard.
Thanks, DeMarcus. You and your colleagues are excellent advocates for our whole student body, and we really appreciate that interaction because, as I think everyone has said, we've learned so much. And Dr. Pope uses the analogy that we were building the airplane as we were flying it, and it really is a group effort with that. So thank you. Let me shift back to a Dr. Friend question. Dr. Friend, this is a specific and a little bit of a hypothetical question in terms of the news that is out about vaccines at the moment. But we had one parent submit a question saying that they are pretty far out of state, a 13-hour drive away. And so the parent was wondering if and when COVID vaccines become available for the student-aged population, is that something that might be an option for their student at UA, or is that something that they may have to work out going home and trying to figure out how to handle? So what, and I realize this is a hypothetical question at this point, but what can, if anything, can you tell us about what might be possible in the spring?
Well, it's a really good question. I certainly don't have all the answers, but I can tell you a lot, I think, and give you a lot of information. I think, first of all, the good news is there is a safe and effective vaccine. We know that, and it's really quite amazing what's been done in the past 8 to 10 months. That's good news. The other thing we know is that allocation has begun across the country. And has started with hospital systems to protect frontline workers and healthcare workers that are interacting with patients on a regular basis. And that initial allocation has begun at our hospital, which is a community-based hospital. It's not a university hospital. And that has begun. So the long-term care facilities are scheduled to get the next allocation. And then there's certain groups that I know the Alabama Department of Public Health are targeting, and campuses are one of those groups. So I do think that campuses, and we are the largest campus, will be getting the vaccine at some point in the spring. And it is our plan, and we're already planning to immunize as many campus community members as we have vaccine. We don't have a definite timeline. We don't know when that will be. And the whole vaccination process is very prescriptive. So we will be given a dose and be told which hierarchical group can have that vaccine. And that vaccine, there's a federal registry, and there's documentation that has to be done. So our goal would be to immunize the entire campus community as soon as those vaccines are available. And then for us to provide documentation to your students, to your children, that they've had the vaccination, what manufacturer it was, and those kinds of things. So we're already planning. Of course, they're unknowns, and we will do our best to keep you informed as soon as we know more. But I do think it's a realistic expectation that if we have the vaccination, that we would like to vaccinate all of the students as soon as we're allowed to. They won't have to travel home and then come back. I think campuses across the United States will have the vaccination before your local physicians and community physicians do, because the process is very prescriptive and very cumbersome to be able to get them and then administer and document them.
Great, thank you, Dr. Friend. I appreciate that insight. Kim, I'm actually going to throw a question to you next. We had a parent submit a question that's really about Bama Dining, and we had invited the director of Bama Dining, but they had a conflict, and so I know you were able to get some info for us. But the parent's question is, what can you tell us about how the university is planning to handle food service in the spring for students who have meal plans?
Of course. Yes, I was able to connect with our wonderful colleagues in Bama Dining, and they asked that we relay this information that the dining facilities, Lakeside Dining and Fresh Food, will be operating in the same capacity that they were operating when students left campus in late November. And so they will operate where they have limited seating with social distancing, but they are able to accommodate some in-person dining. They will still remain to be all you care to eat. It's just that instead of you self-serving, you serving yourself that food, staff members will be there to do that for you. And so if your student wants an extra scoop or an extra serving, they just need to let them know that, and they can go ahead and get as much as they care to eat. As far as food is concerned, they are instituting a new mobile ordering app for both retail and Lakeside and Fresh Food Company. And so, so students can, through that mobile ordering app, order what they want, then go pick it up and go, so that they don't even need to worry about lines or using any of that time or anything like that. So you can get all of the information about that mobile ordering app, as well as their dining procedures and operating procedures, on their website, which is bamadining.ua.edu. And they are always ready to adjust their operating procedures should they need to, based on system guidelines, UA system guidelines, or based on environmental health and safety guidelines. So this is how they will open. This is how they are prepared to open, but they're also ready to be nimble and be flexible should they need to do that. I will also add that Greek housing, we were able to contact and be in connection with our colleagues over in Fraternity and Sorority Life, and they will also resume dining procedures in the same way that they ended the fall semester. So whatever each chapter had determined, or whatever operating procedures each chapter was using, they will go ahead and resume as they were in November. So if you have any specific questions about your students' Greek chapter dining, you can go ahead and reach out to that individual organization.
Wonderful, thank you. Dr. Han, I'm going to come back to you. I have one more academic focused question that a parent submitted. If a student needs to request an accommodation because of a pre-existing condition or health concerns, what does that process look like in the spring, and is it different from the fall? What can you tell us about spring academic accommodations?
Sure. We call the COVID adjustment process for the spring. It's virtually the same as for this fall. You go to our ods.ua.edu website, and in the very front, the first front page, you click the link. You will enter the COVID request form, and students just enter all basic information and provide all documentation required, and then send it in. After students send in the request form, then they will be contacted via email. The first email, just tell your student, watch their email. The first email will be call the office, call the ODS office to talk with a staff member. Basically, I think that is, I should pull back, call the ODS office, set up appointment. Should set up appointment and then to meet with ODS staff member to talk about what the specifics of accommodation needs. Right now, I just talked with the director of our ODS. If you send in today all the required information, I think you still could have some appointment after the holiday, on the January 6th or 7th, even though university, don't wait until university open, because these ODS staff will talk, interview the students, will be virtual. So, don't wait until university necessarily open. So basically, the process is the same. Just enter all the information as required and talk with the ODS staff and understand the needs, and the process will be the same.
Great, thank you. Dr. Pope, I saw that your internet kicked you off, but I'm so glad you're back. I have a quick question for you regarding return to the residence halls. So when students are ready to move back into their halls in January, do they need to set up an appointment? Do they need to schedule something? How does that return process look?
Yes, ma'am. Thank you, Erica. I did get booted there briefly, so I'm glad to be back in. Essentially, what we are doing is that we're opening up the residence halls officially on January 9th. We have some students, unfortunately, who will be here on campus. We have some student athletes who are participating in events. We have some students who are from abroad who are living on campus right now. The numbers are very small, and what we've encouraged students to do if they're coming in back from out of town is that they not return any sooner than January 9th. that point, obviously, again, we start testing on the 7th. They will have a chance to get testing if they need to once they return. But as such, there is not an appointment process from that perspective. But again, with the testing process, again, be aware that there is an appointment time, a system set that will go live here on January 2nd that will allow them to get their testing so that they are in a good place to return to their residence hall and be clear for reentry.
Great, thank you. DeMarcus, one more question for you. I know that fall was probably not what a lot of people expected, and especially for first-time students on campus. Some of those students, we have heard from their families, really had a hard time getting connected, right? They lost out on some of the very traditional, meet your hallmates kind of things. But I know we offered some options. But from a student perspective, if there's a family member listening whose student found it hard to plug in and get connected in the fall, what would you recommend that they do for spring? Where should they start, and how do they build and make those connections?
Yeah, that's a great question. I would suggest starting with the Office of Student Involvement. I know they have Get On Board Day once a semester at the beginning of the semester, and it gives students the opportunity to explore over 600 campus organizations that we have, ranging from the Sky Watching Club to the rowing team. So students have many opportunities to get involved in something that they like. So I think that should be the first step. So parents should encourage students to follow the student involvement social media accounts. Also look up online the Source, Source UA, and they'll be able to find any organization that they're looking for here on campus. And if they don't find an organization that they're looking for, they can create one. And I think all you need is 10 students and 1 faculty member to sponsor that organization, and you can create the tree watching club that we don't have here. So students have the opportunity to do whatever they want here at the university, as long as it's through guidelines, of course. But make sure you go through the Source or student involvement to find whatever they need. And I guess also a quick plug, university programming has different opportunities for students to get engaged Thursday through Saturday of every week. So students can go to any of their programs. I know they've been doing pretty much social distancing programs this period of time. I don't know how that'll look when we come back in the spring, but I know even during times where we were virtual, they still held programs. So making sure they follow the university program social media as well will be very beneficial.
Great, thank you. And Dr. Pope, a related question for you. If students need help, they encounter a challenge, or they're struggling, or they just don't quite, COVID has thrown a lot of things at us that we probably didn't anticipate or expect. What are the other support mechanisms that are offered to students who may need them?
Thank you, Erica. I think that, we want to encourage you and help you to realize that there are support systems across campus. Obviously, again, our faculty and staff are well equipped, where they can point students in the right direction if something does arise. But at the same time, we also have places specifically set aside for that. Our counseling services office has been very responsive this semester. At the very start, we have many students who are utilizing telehealth, teletherapy options. We are also seeing students. We saw students at the end of the semester face-to-face. So if there is a situation where your student feels like they need additional support and encouragement, certainly certainly look into that office, as well as our Student Care and Wellbeing office. Our Student Care and Wellbeing office does a multitude of things. And I want to remind you that if something comes up again, certainly beyond the mental health issues that your student may experience, whether it be physical or financial, et cetera, that's another great resource. The Student Care and Wellbeing office is under the Dean of Students department of our division, and it just helps me students. It serves as a navigator as such for the campus. It just points students in the right direction, and it's a great resource to help students over those times where they have some challenges that are preventing them from being successful inside the classroom as well as outside the classroom. Our top priority is, again, engaging students. And it's been a challenge for us And we know that for many students, it's just because of the environment that we're in, it's they need that additional assistance and support. And we want to make sure that you know that we are here for them.
Great, thank you. I'm going to give a very quick shout out to our housing and residential community staff who is watching us live and just sent me a quick text with some new information to share as a follow-up to Dr. Pope's question about when students move back on campus. So thank you to our fantastic HRC staff. We appreciate you. We are not asking students to schedule a move-in time, but we are asking students to fill out a form that lets us know when they plan to move back in. The form is in the My Housing portal. It's not required, but strongly encouraged and recommended. It will help us know and be prepared on the testing end as well to have a better sense of when to expect people back on campus. Your student, if they live in a residence hall, received an email yesterday from our housing staff that has the information and a link there. So thank you, HRC staff. I appreciate the help in the live session. So thank you for that. One more sentinel testing, back to you, Dr. Friend. I know we've touched a little bit on sentinel testing and how it will be different in the spring. Can you talk to us a little bit about what the sentinel testing program will look like? Will students have to go a specific place? And what's kind of the purpose? Just any more information you can provide us about spring sentinel testing.
Sure. Yeah, all good questions. So again, we learned a lot from the fall. We learned what worked well. We learned what didn't work well. And we've had a lot of feedback from students and faculty and staff about what we could do better with sentinel testing. And we have tried to modify our plan to incorporate as many of those things as we can. One thing that we learned early on is that the more accessible things are, the easier the use is, the more people will take advantage of it. So we're going to have sentinel testing in our East Storm shelter, but we're also going to have 5 rotating locations across campus, around dorms, around the quad, so that students can schedule an appointment wherever they want, wherever it's going to be most convenient for them, get the test done. It's a simple observed nasal swab. It's not the nasopharyngeal swab that we did this year with the rapid testing. And then we will get those back to our lab here on campus. Because we have all of the information, it's much easier. There's no registering for apps. Our goal is that each individual on campus gets selected no more than once a month if they participate. That's one of the incentives, is you should only have to participate 3 or 4 times during the entire spring semester. And that will also hopefully drive more participation. And the purpose of sentinel testing is to watch and see its random selection of the entire campus. So random selection of students, random selections of faculty and staff in different populations, to see what is going on in the asymptomatic environment. And throughout the semester, we saw that in the asymptomatic population across campus, it was 1% to 2% transmission, which was much better than the rest of the community, the state, and the nation. And so we want to continue to do that. Of course, if you're having symptoms, or you've had exposure, or there's exposure in your dorm room or your dorm floor or your fraternity or sorority, we're going to do a different level of intensive testing. This is for people that no symptoms, nothing's wrong with me. We want to make sure that asymptomatic population the numbers are really low, and that the transmission risks to the campus is really low. And by doing all the things that we do, by isolating, quarantining, education, health check, all those different modalities, and then being able to really monitor, we're able to make good decisions, and we're able to make the right decisions. And I couldn't say that early in the fall because there were so many unknowns, but we put so many safeguards in place that I know it's not just for our students, but for our faculty and staff. Campus is safer than the rest of the community and the rest of the surrounding area. And so we want to have as much activity as possible, as long as it's done in a safe fashion. And by the way, all of the sentinel testing is going to be paid for by some sort of grant as well as the reentry testing if it is done on campus. So that will be taken care of. Exposure, symptomatic testing will be billed to insurance.
Great, thank you. That's an important clarification. I have one quick follow-up, Dr. Friend. When students return, and it may be that when you mentioned they may have to wait for that 48-hour period between the test and the result, what is your recommendation that they do during that period while they're waiting? I know we're probably going to encourage always wear your mask, limit interaction, but in that waiting period, go back to your residence hall. What should you do in that time?
Well, we know that events during those first 2 weeks are going to be restricted, which is part of the plan, which is good. And we also know what we've learned is that when we've seen 3 or more cases in a specific area, there are very few other cases in that area. So, one would think, okay, well, 3 people in a sorority have it, the whole sorority is going to be infected, but that has not been the case. We may see 1 or 2 additional more cases, but because people, even in the same room, in a dorm, if they're practicing good precautions, they're not going to get it. That's what we found. So, and we've had cases in the classroom where we've had to go out and test and nobody in the classroom was positive. So we know our guidelines work. We're just going to reinforce, educate, and really try to get folks to follow them during that time.
Perfect, thank you. I have one last question for DeMarcus, and then we'll send it back to Kim to wrap up. But DeMarcus, from the student perspective, I'm sure when you ran to be RSGA president, you couldn't quite anticipate this term. But what did you learn in the fall? And what would you encourage your fellow students how to approach the spring semester, just from a plan of this isn't exactly what I expected, but here's what I learned to make spring a little bit better?
Yeah, so I would say I don't think I learned pretty much anything. I think I was reassured that the University of Alabama is more of a family than we think it is. There's more that unites us than divides us, and that the university administration truly cares about each and every student. So for the spring, I just want students to know that even though Rose may seem far away, it's not that far, and the university administrators want to hear what we think, and we are basically the center of the universe at the University of Alabama, because without the students, there would be no university. So make sure that we not only make sure our voices are heard, but we hold our administrators to the highest standard that we can, so we can continue having the highest level of education here in the state of Alabama. And I want to shout out Dr. Pope again, because he came in literally right when I did, when COVID first started, and neither one of us knew what we were doing. But I think we both have knocked it out the park, so to speak. Some days have not been good days. Some days have been amazing days, but we've made it through. And that's thankful to the parents for holding us accountable. Because I know I've gotten emails from parents, and I'm not even an administrator. So, but they make sure that we stay on our toes and that we do whatever we can to make sure that the student experience at the university is amazing. So I just say, come in, continue being resilient, and let's work.
Great, thank you. I'm going to add what I learned too. I feel like everyone else has gotten to share what they've learned. I've learned that student initiative, the initiative that a student takes, is just as important in virtual life as it is in regular or normal or in-person life. And so what we would always tell students that you have to show up in order to get the most out of something and get the most out of an experience. And I think that is the case in virtual classes, in virtual events, and ways to connect with other students and resources virtually. If you don't show up and utilize those virtual resources, then you're not going to get anything out of them either. And so I would just recommend, as we are still offering kind of both sets of opportunities going through the spring, both some in person and some virtual, to really encourage your student to take the initiative to get the most out of what is offered, because if they don't, then they're not going to get anything out of what is offered, which sounds obvious to us, but sometimes students need to be reminded of that. So not to just count an opportunity out because it is virtual, but to go ahead and take advantage of those resources. I have a couple things, just last minute reminders. Number one, please encourage your student, or if you are a student who's watching with your family, we love that. Please make sure that you are checking your Crimson email throughout this break. You don't necessarily always have to respond to all of those things, but being aware of anything that might change is really critical to your success as you re-enter campus life and academic life in January. Number two, just as a reminder, campus offices are closed starting at 5 p.m. Central Time on Friday, and they will then reopen on January 7th at 8 a.m. Central Time. Throughout that duration, if you or your student has an emergency, they can contact UAPD's dispatcher at 205-348-5454 to be connected to some of our on-call staff, whether that is the on-call member of the counseling center staff, an on-call housing staff member, on-call women and gender resource center staff member, or the on-call dean. And so please make sure that you keep that in mind. And we will be back rested and ready to go January 7th as faculty and staff members to support students through in success throughout the spring. And then my final reminder for parents and family members is that we did launch a brand new communication tool this fall called the UA Crimson Connection. It is an opportunity for you to customize the communication that you receive from the university. So based on your experience, your students' experience, you can determine exactly what pieces of information you want, as well as how frequently you want to hear about that. All you need to do is just create a free profile through ua.campusesp.com. That's ua.campusesp.com, and complete the onboarding survey as you set up that profile, and that will determine what information you receive from us and how frequently. And so please make sure you do that. We would appreciate it. It helps us customize and make sure that you're getting the information that you need, as opposed to a one-size-fits-all, which doesn't always fit. So thank you so much again for tuning in. We hope this is helpful. We hope that you potentially, if your student didn't join you, maybe your student will watch this again, and you can discuss. And as always, we are here to assist. Thanks again for our panelists. We appreciate all of the hard work that you all did this fall, and the colleagues that were not here able to join us today. This fall was something else. But here we are, and we made it happen, and kudos to the students because they saw great success as well. So thank you so much. Have a great